Today, the Medical Center's emergency department is featuring more than a new state-of-the-art physical plant. Coinciding with the naming of the Michael J. Daly Center for Emergency and Trauma Care was the implementation of a minimal weight program, which has boasted impressive results and is quickly becoming the standard of care for emergency rooms across the nation. Patients are no longer experiencing anxiety related to long wait times or becoming so frustrated that they leave without being seen. Thus, the patient experience in the ED has resulted in dramatically improved patient satisfaction and safety scores. Dr. Jody Gerard, Chairman of Emergency Medicine, explains the transformation of care in the ED.
In the past, a patient would come into a triage nurse, would get triaged, would come to a busy waiting room and wait. Then they would go see the physician, come back to the waiting room and wait. Then they would go to the registration booth, be registered, come back to the waiting room and wait. Then they would see the final nurse, get their instructions, their treatment, their discharges, their prescriptions, and wait until discharge. Now all of that happens at one time. Both Dr. Herman, a patient, the registrar, the nurse, sees a patient at one time. And so all of that duplication of effort is minimized. And as a result of that, we've seen dramatic changes in both patient satisfaction, the waiting time to see a provider, the waiting time to get upstairs, the growth in the revenue and in the volume of the emergency department as a whole, and if you look to your right, an empty waiting room.
As of this filming, the emergency department has reduced door-to-doctor time to 35 minutes, with half being seen in 23 minutes, while also decreasing the percentage of patients who left without being seen from 3.9% to 1.2% since the inception of the program.